Hi everyone, my name is Rebecca Cash, and I have here with me my mother-in-law and my husband as my audience. My topic today is Rocky Mountain Spotted Fever, in short form RMSF. This is a medical condition caused by bacteria, gram-negative bacteria, and this bacteria is transmitted to human being by a vector, tick. These ticks, they are infected with this bacteria called Rickettsia rickettsii. They can obtain this bacteria by maybe biting animals, the little animals like squirrel and chipmunks in the wood area, and when they come out and get in on a person or another animal, they transfer this bacteria to the animal. And this bacteria is prokaryotic microorganism. This bacteria can cause a lot of health issues in a person. It takes about 2 to 10 hours for the infection to take place when a tick bites, infected tick bites a person or an animal like a dog or cat. This is the shape of a tick, Rickettsia bacteria. Is a rod-shaped bacterium. This bacteria interferes with the human body and affects your organs if not treated. It's recommended that Rickettsia infection should be treated immediately as soon as it's noticed. And sometimes you don't have to wait for the symptoms to start appearing before you start taking treatment, because the symptoms does not appear immediately on some cases it comes immediately, some cases it takes a while. Some of the symptoms can start with nausea, vomiting, fever, and most especially what is known for is rash. And these rashes can appear in places like the palm, on the sole of the feet and the trunks, and it's pink in color and scattered. This is a picture of a tick that is infected with Rickettsia, and when a tick like this bites someone, or if the fluid from such tick gets on somebody, the person can get infected by this Rickettsia infection. This is an example of a person that was bitten by this infected tick, and you can see the rashes all over the legs. And this is a severe case. If not treated, it can lead to organ failures. Population that are most at risk of getting this infection are people that are in like North Carolina, Tennessee, Oklahoma, Missouri, and USA, and sometimes the Red Indians, the American Indians, because there are people that are known to live in wooded area, and adults, male adults over 40 years old, and children under 10 or 15 years old. These are people that are at risk of getting this infection, and people that live with lots of animals like cats and dogs, and sometimes people that are having compromised immune system. This disease affects the community as a whole. There are a lot of cases that have been reported, like according to CDC, Center for Disease Control and Prevention. The cases of Rickettsia have been reported in 1993 of about 345 cases, and it increased to 2,553 cases in 2008. but after a while it changed down to 1,791 cases in 2009. This affects the community because when people are affected with this bacteria, it can be transmitted from one person to another through this vector ticks. So it's something of concern today to everyone. Most times the best treatment for this bacterial infection is the use of antibiotics. Doxycycline is mostly used to treat it as soon as it's noticed, and it's advised that the person doesn't wait until the symptoms are fully blown. As soon as you notice the infection is taking place, the person should seek medical help immediately, and this doxycycline is one of the best medications to use to treat this infection. Preventive measures to take in order to prevent the infection from this tick, rickettsial infection. Most people that have animals to watch out and always try measures to prevent their animals from contacting ticks, and also people that live around the wooded area or near the forest should also try and keep their immediate environment free of ticks. And if you go hunting, dress with the long sleeves and pants, so that way your skin is covered and you don't get bitten by this tick. And in case you're bitten by a tick, do not crush it to your skin. Try to pull it from the head down. That way the tick does not break up in your skin and leave some tissues on your flesh, which can even transmit the disease without you being bitten by the tick. And also, if a dog or a cat is infected, such animals should be isolated and taken care of, and make sure the ticks are gone before they can be allowed to come around other people and other animals. And when people notice any sign of this infection, they should quickly take care of themselves by going to a doctor and seek medical attention before it's too late. And that's the end of my topic. I hope you enjoyed it. Thank you.